Okay, now look at this question. Describe the types of bronchial breath sounds with causes. Okay, so they're asking about some breath sounds. That means breathing sounds. Okay, so these sounds, in that so many types, in that the bronchial breath sound, in that the types they're asking. Okay, bronchial breath sounds types and the causes for 3 marks. So let's get started very quickly. So if you look at the textbook, it says that there is when you auscultate somebody, right, on the trachea, you'll get some tracheal sounds. If you auscultate somewhere here, you will get bronchial breath sounds. If you auscultate here, okay, bronchovesicular breath sounds you'll get, and here most of the lung field you'll get vesicular. Okay, this is normal. In normal places, this is normal. But if you find this in a different place, this sound, then it is abnormal. Okay, so breath sound, so many okay, so many types of breath sounds are there. Vesicular breath sound, bronchial breath sound, bronchovesicular breath sound. Okay, vesicular is what you hear in the whole of this lung, maximum lung field. Okay, that is vesicular. Bronchial, you saw. Where did you see the bronchial? Go back here and see where you actually saw the bronchial. Here somewhere, right below the trachea. Somewhere here they are saying bronchial breath sounds. Normally you can hear him. Okay. Now, then you have bronchovesicular. Then you can have other sounds and all that we have put here. But here for 3 marks, they've just asked you the types of bronchial breath sounds and the causes. So you have to write these 3 words: tubular, cavernous, amphoric. Okay, guys. So let us look at these 3 words. Very important to write in the exam: tubular, cavernous, amphoric. Okay, tubular, cavernous, amphoric. So when you talk about bronchial breath sounds, so look at this. Bronchial breath sounds will be like this, the diagram that they have drawn here. So the inspiration will be small, there'll be a gap, and there'll be a long expiration. Okay, when you put the stethoscope on your that part, okay, where you can, that airway path below the trachea. Okay, so there you should get this bronchial breath sound normally. Okay, this will be loud, high pitch, it will be. Okay, high pitch. Inspiration sound is shorter than the expiration sound. There is a gap, okay, that you can hear, and this is where above the clavicle they are saying, or just over the manubrium. Okay, this is what they have asked in the exam. We'll focus completely on this. Okay, guys, so bronchial breath sounds, you can see that it is high pitch, loud, heard above the clavicle, over the manubrium. The inspiratory sound is shorter than expiratory. Okay, so you draw this diagram and there's a gap like this. If you draw one diagram over, okay, they show that there's a gap here and show that this is inspiration and this is expiration. Okay, if you can draw this diagram also good. And high pitch, loud it will be. Okay, because it is going through this tube. Okay, bronchial. Okay, now let's go and look at more details. Bronchial breath sounds, you can hear it over the large bronchi. Inspiration is short, expiration is long. There's a pause between the two. So where can you hear? Over the large bronchi. This is normal. 3 types you will write: tubular, cavernous, amphoric. Very good, guys. Okay, guys, now you listen to bronchial breath sounds. Okay. So here what you have to write for the 3 marks, the types of bronchial breath sounds and the causes, right? So tubular, cavernous, and amphoric. See, tubular can be normal over the large airways, exactly where you have to hear bronchial breath sounds. If you keep there, you will get tubular only. Okay. Cavernous, amphoric, they are not saying it is normal. Tubular basically is high pitched. Cavernous and amphoric are low pitched. Guys, that's why I put them in light gray. Low pitched, low pitched. These two are low pitched. Only tubular is can be normal in the right place. It is high pitched. Okay. And which are the two which are low pitched, guys? Cavernous and amphoric. Very good. Now, just tubular means a tube kind of thing. Okay. So remember, that is why they are saying that if there is a bronchus is patent when there is a collapsed lung or lobe, when a large draining bronchus is patent. Okay, something like a opening, right? So I'm thinking this is another cause for this tubular breath sound. Okay, in the wrong place, but not in the on the airway. And then If there's pleural effusion, above the level of pleural effusion, again they're talking about some patent bronchus something, okay? So pneumonic consolidation, collapsed lung, patent bronchus, pleural effusion, above the level of pleural effusion, patent bronchus, patent, that is what you have to remember, some kind of a tube you understood, right guys? Tubular, and this can be normal, okay, over the large airway. So this is tubular, okay? So when and all you saw this causes, you will write normal over the large airway. Then you saw pneumonic consolidation. Then you saw collapsed lung with patent bronchus. And then one more was above the level of pleural effusion, patent bronchus, again something like that, okay? You got it guys? Tubular is done. And what did you say about tubular? It is high pitched, okay? Very good. Now let's go to cavernous. Cavernous is low pitched, so we already know. And when can you hear? Some cavity you should have, okay? Again, communicating bronchus, cavity. Okay, presence of thick walled cavity. Okay, here it's thick walled cavity. Amphoric, they're saying it is smooth walled cavity. Okay, thick walled cavity, smooth walled cavity. Okay, cavernous. Tell me about cavernous now. Low pitched. Very good. You already know it's low pitched. Then cavity, thick walled cavity, communicating bronchus. Okay. Amphoric, low pitched. We already know this. Metallic, high tone, metallic. Amphoric. Okay. So amphoric is what, guys? Metallic. That's metallic. Amphoric. It's metallic. It's low pitched, but it's high tone, but tone is high. Metallic. Okay. In this where smooth walled cavity. Again, they're talking about some fistula. Bronchopleural fistula. Tension, pneumothorax. There is air there. Pneumothorax. Okay. So you got it. I hope you will be able to remember this, okay? See, what they are saying is bronchial breathing, normally tubular, right? Cavernous and amphoric, they are showing double line. So if you want, you can draw like this in the exam. You will also get some marks, double line. Cavernous and amphoric. Draw like this, okay? For cavernous and amphoric, for both you draw like this. For bronchial, you draw like this. Okay, got it right? Bye-bye.